It's also, I mean, nurses, there's one of the articles has a competency that we can use for teaching, and
I think I saw that with the long questions.
Yeah, so there's a competency that we have to make sure our nurses are competent in using this technique. But so back to what I was saying earlier. So if you look at caring practices, clinical judgment, systems thinking, facilitation of learning, and clinical inquiry. So you think about teach back as a continuous looping of assessing the patient's, what is the word I'm looking for? I hate it.
You said vulnerability.
Well, we're assessing their vulnerability, their stability, their resources, their participation in care. So you're saying not only what are you going to do, but how are you going to do it. And so when they say, I don't know, you're assessing. It's all of these things.
This anesthesiologist had everything except for the predictability, because he was really off of his routine by having a cabbage. And so was his wife. So I was thinking, oh, well, he's resilient. He has a great support team. He has a car. He has access. He has money. He has a shower that he can walk in. You know, right. It went down the list.
Exactly what health literacy is about, is because the person who is the anesthesiologist still has health literacy issues because it's themselves. You know what I mean? Mm-hmm. It's too personal. So when my friend who's a nurse and an oncology nurse has breast cancer, do you just say, you understand this here, or do you go through piece by piece, because she has to own it?
Yeah.
So we have to do evidence-based practice of teach back, even with those that we are assuming knows. Health literacy is not just for the poor and the language barriers. It applies to nurses
and to your internal map.
And
so when you speak it, it's part of owning it. Words have a lot of power, and so we don't want to take that away from our patients. We want them to be able to have that.
Right.
And so teach back is very strong. I really like it. I don't know how now with telemonitoring you have a little bit of that over the telephone, but I like your system at your outpatient where the phone is connected somehow, or the computer's connected.
The labs are all
Bluetooth.
Yeah.
Bluetooth scales and Bluetooth blood pressure cuffs. That's unbelievable. I don't think the UW has that.
Sorry.
It's a very little clinic.
Yeah.
And so Chuck, I could get Chuck to come talk, but probably not tomorrow, and he would also take 2 hours to talk. But he could talk about what their clinic is doing and their outcomes. But they have 4 nurses that work full-time, and they have somebody who's on call every night. So round the clock. They have weekend call. It's just a regular cardiology clinic with 4 nurses. And their cardiologists are paying for it by saying, our patients are not going in the hospital. We are going to have these phenomenal outcomes. And they...
Do the Bluetooth call them? So if a patient takes their blood pressure, like let's say they go to the bathroom at night, and they feel dizzy, so they take their blood pressure, and it's 75.
No, so at night they can call. They have 24-hour. Remember the article, it was a qualitative study that they needed to have an advocate. They felt cared for by knowing they had an advocate.
I want that in here in our paper, in our stuff. Okay, go ahead.
Yeah, so patient-centered.
Patient-centered care, they have to have an advocate. And so by having that ability to call and knowing that they have somebody who will escalate their care, they will call 911, they will be up, they will call them back in 30 minutes after they've taken their Lasix, their additional dose, or their, whatever, who's talking them through until the medics get there, if that's what needs to happen, or whatever. By having that person that they can call 24/7. So Chuck was telling me that they called because they said, so I'm sitting here and I'm looking at these 2 cans of soup. One has this and one has this, and can I eat this one or this one? And they both had one had fake salt, but it was a large amount of fake salt.
Which is potassium.
Yeah, but the patient had some renal failure issues. Yeah. So Chuck gets woken up at 11 o'clock at night because the patient's hungry and wants to eat something. So which can of soup do I eat?
Yeah.
So they have that resource. So
what do you tell them? Don't have, pour a lot of water in your soup.